All right, thank you. Good afternoon. I'm Dave Anderson, and I serve as chair of the Master's Level Psychology Licensed Clinical Psychotherapy Advisory Committee of the Kansas Behavioral Sciences Regulatory Board. Today is Wednesday, April 1st, 2026, and I ask the members of the advisory committee to respond to a roll call to signify their presence at this open meeting that is being conducted remotely by conference call and other electronic medium. David Stevens.
Here.
Elizabeth Birch.
Here.
Ginger Hill.
Here.
Rebecca Jabara.
Here.
Lauren Luck.
Here.
Sarah McMillan.
Here.
Iris Pauley.
Here.
As noted, Robert Pedrosa is not here currently. Caitlin Reed.
Here.
Jennifer Schreiner.
Here.
Josh Tangway.
Here.
I note the following BSRB staff members also present. David Fye.
Here.
Next, David Fye will read a message concerning this meeting being held remotely.
Thank you, Dave. This is David Fye, Executive Director for the Kansas Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about any concerns, but the Kansas Open Meeting Act, or the KOMA, does not require the advisory committee to provide public comment or answer questions from individuals. Individuals requesting to provide public comment could contact the Executive Director prior to the meeting by sending an email to david.fye@ks.gov. There will be no time for public comment as no individuals requested time for public comment. Because we are connected in this public meeting remotely by conference call and other teleconference ability, I state for the record the following information. Public access to this meeting is being conducted by medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call or by viewing the board's YouTube channel. While the meeting is conducted remotely, the requirements of the KOMA are not suspended. Therefore, we will be conducting this meeting pursuant to the KOMA. On February 18th, 2026, we sent notice of the advisory committee meeting to all individuals who had requested notice of such meetings. The notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and any other media material have been posted on the board's website and are available for review. You may also request a copy of the agenda specifically by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel that allows the public to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, you may contact the board office at 785-296-3240 or send an email to bsrb@ks.gov. A recording of this meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And the conference call line is active. I did check it before we got started. There's no one currently on the line, but if I hear someone connect and introduce themselves, I will let you know.
Thank you, Dave. The meeting is now called to order, and the advisory committee will begin its discussion of the first item on its agenda. So our first agenda item is if there are any modifications to the current agenda. All right, seeing none, I would accept a motion to approve the agenda.
I'll motion to approve.
Thank you. Second?
Second.
Thank you. So we have a motion and a second. Any further discussion? Hearing none, all in favor of the motion, please say aye.
Aye.
Very good. Those opposed, same sign. Motion carries. The next item on our agenda is approval of minutes from the February 4th, 2026 advisory committee meeting. Everybody have an opportunity to review those? Any requested changes to the minutes? All right, seeing none, I would accept a motion to accept the minutes as printed.
So moved.
Thank you.
I'll
Second. Thank you very much. We have a motion and a second. Any further discussion? Hearing none, all in favor of the motion, please say aye. Thank you. Opposed, same sign. Motion carries. Okay, Dave, that takes us to the executive director's report.
All right, thank you, Dave. I'll jump in and start with some legislative updates for you all. You may recall we've had some discussions about tracking the legislature in the spring. Every year, usually the legislature tries to meet for no more than 90 days. Sometimes that can be extended with action by the legislature, and sometimes it is shorter. The way that 90 days is counted also differs by different legislature. However, they are getting close to wrapping up the session for this year. And so if you have been tracking the legislature, what generally happens is at the start of January, the legislative session begins. Usually you have some actions like the governor's State of the State address. The House and the Senate start to have committee meetings. Sometimes those are informational, and then eventually bills are introduced. Bills receive hearings on both sides. I think for what would be somewhat surprising to some people if you're not tracking this closely is that during the session, lots and lots of bills are introduced, and not all bills get a hearing. Actually, a small number of bills compared to how many are introduced actually get hearings, and then a small number of those make it to both sides. You'd have to have it passed in one chamber and then passed in the other. So when you're looking at the legislative session, sometimes there are hundreds, maybe even thousands of bills that go through part of the process, and not all of them make it through the process. But there's also the budgetary process too. Every state agency has a budget that either they are requesting funding from the legislature or they are asking for a limit. If they are self-funded or available other funding sources such as licensing fees. And so in the appropriations bill each year, the legislature puts a limitation on how much can be spent by each agency. And so that is sort of what the BSRB goes through every spring. We talk about our budget with whichever committees are meeting. Usually the House has a standing budget committee. The Senate sometimes has budget committees. Sometimes they adopt the position of the House. And ultimately, there will be an appropriations bill that goes in front of both chambers. And then what typically happens is the legislature goes through that main part of the session. They break, and that break is to allow the bills that were passed to be sent to the governor's office for review. And then the governor has the ability to either sign those into law, the governor can veto the bills, or the governor can take no action. And if the governor takes no action, eventually those bills become law because of lack of action. And so that's where we are right now. Just last week, the legislature went through a furious part of the session where both chambers were passing a lot of bills. Sometimes what is happening is that a bill may be passed by one chamber with certain amendments, and then the other chamber passes it slightly differently. But if there's any items of difference with the two versions that were passed, then the legislature has the ability to call a conference committee, and you would have three members of each committee, usually leadership of the chair, the vice chair, and the ranking minority member would be part of those conference committees, and they would meet to resolve items of difference. And then that consensus position would go back before both chambers to attempt to be passed. So we've been tracking a lot of legislation as it went through the process. Not a lot of that legislation really impacts the professions regulated by the BSRB. But one of the items that was passed before they broke was an appropriations bill. So that will be sent to the governor's office. It will be up for the governor to review. One of the things that is slightly different about the appropriations bill than other bills, the governor does have authority to do line item vetoes in the appropriations bill. And the governor can veto specific sections. And then when the legislature comes back in about 2 weeks, they have the opportunity to consider those all together, or they can consider them item by item if they wish to overturn any vetoes. So that's sort of a big picture look at what the process is and where we are currently at. So the appropriations bill was passed by both chambers. It did include the budget for the BSRB. And so it included no real changes for this current budget year, a small modification for next year, And so we're just kind of waiting to see if the governor will take action on the bill, and then what the legislature will do when the legislature comes back in a couple weeks. As of right now, on the official calendar, the legislature has scheduled 2 days for a veto override session, is what they call it. Sometimes it's called an omnibus session. And so in a couple weeks, they are scheduled to come back for 2 days. They could, of course, extend that if they wanted to. But right now, that's kind of what we're looking at, and we'll continue to monitor things. There is one item that I wanted to kind of bring to your attention in the budget bill. We've been monitoring this. Last year, there was some language in the budget bill that was proviso language. And what a proviso is essentially you would attach something for a state agency or several state agencies that would either direct them to spend money for a specific purpose, or would say, potentially you cannot spend money for a specific purpose. And one item that was in the bill last year had to do with the topic of DEI, and it dealt with certain agencies needing to modify programs or cease programs or positions that were specific for that purpose. So that was something that went through last year in the appropriations bill. This year, there was a bill that was discussed in committee that would have an impact on universities and certain course requirements. And that bill did not move forward, but some of the language from that bill was made a proviso in the appropriations bill. I did want to make you aware of that. That is in the final version of the appropriations bill that was passed. It has been sent to the governor for review. So I am unsure if that language will stay in the bill or not, based on vetoes or possible veto overrides. But I did want to make you aware that some of the language in the bill does seem very similar to the bill that was at least had a hearing earlier this year. So we'll just kind of continue to monitor that. The impact on universities and different groups, I'm unsure of that at this point, but we will kind of figure that out if that actually does get signed into law later on. But I did want to make you aware of that. There is some language in the appropriations bill that does affect some of the universities and some of the policies there. In terms of some other items of note, I wanted to give you some updates on the recent action by the board. I try to keep the advisory committees informed of action by the board. The board last met on March 9th. The board is continuing to work through the recommendations on unprofessional conduct items to try to standardize those for the positions. The board continues to move through that. The board also considered a number of recommended regulatory changes by some of the professions and the advisory committees. Also, the board did receive recommendations on the regulation of artificial intelligence from 3 different groups: the Behavior Analyst Advisory Committee, your committee, and then the Professional Counseling Advisory Committee. The recommendations were somewhat similar. So now the board is going to be waiting to see if there will be official recommendations by the other advisory committees, or if not, then the board will have the choice to move forward and consider the recommendations in terms of a board position. But right now, only about half the committees have forwarded an official recommendation to the board. The board also had a conversation. It had received a message concerning if the board would be open to a possible licensing pathway for artificial intelligence mental health agent. So that was an interesting discussion by the board. Conceptually, this is something that we thought, could be considered by different licensing boards at some point in the future, perhaps at a later date. But since it was brought to the board's attention, the board had a discussion on it. I think, based on the way a lot of our licensing laws are written in statute, they are from the perspective of a person who would be seeking licensure. And so the concept of a mental health agent that is a non-person does not really fit with our existing standards under the law. So it would require statutory changes at a very minimum to even be considered. But I think the board had other concerns about the concept of AI, at this point. So the board did not take an official position at wanting to open up that conversation and consider that at this point based on some current limitations and other factors. But it was something that was brought to the board's attention, and the board had a conversation around that topic. And ultimately, what we will continue to do is monitor if other states take different positions, or if there is, action in a certain state regarding that topic. But as of right now, it has just been something that was brought to the board to see if there was interest, and based on limitations and concerns, that is not something the board is moving forward on right now. Additionally, every year we hold an out-of-town board meeting. We try to move this meeting around the state, and it allows the board a full day to work on items that would require longer discussion, perhaps future planning for the board, different items like that. Over the last few years, we have held this meeting in Overland Park, Wichita, Lawrence, and Manhattan. And so the board did decide to go ahead and continue to hold this meeting. This year is going to be Monday, September 28th, and it will be in Kansas City, most likely Kansas City, Kansas. So we will be making arrangements for that and providing more information once we start to get some of the details of that figured out. But that is an exclusively in-person meeting, but it is open to the public. We've had public attendees at most of these out-of-town meetings, so just kind of wanted to put it on your radar. We'll have more information, like I said, once we start doing more of the scheduling for that meeting. And then in terms of the next upcoming board meeting, that's going to be on May 11th. One of the unique items for that meeting is that the CEO of the Association of State and Provincial Psychology Boards, Marianne Bernetti Atwell, is scheduled to come in person and attend the board meeting. And so it'll be exciting to just see her there and have her get an opportunity to meet our board members. Dr. Bernetti Atwell is someone that I have had a chance to meet through the ASPPB meetings, and she has made it a priority over the last several years to try to get out to meet all of the licensing boards in the different states and provinces and territories. And so I thought this was a great idea that she had, and a great way to connect with some of the states that are more active and also the ones that are not. And so she reached out with us a few available times, and this was the one that most board members could attend and meet with her. And so looking forward to seeing her in person at that meeting on May 11th at 10 a.m. So. I also, as part of my report, I did want to give a little bit of time to a topic in terms of things that, come through in terms of news. And some of these items, maybe the board doesn't have specific, control over, or it doesn't fall under our jurisdiction specifically. But Josh Tangaway did forward some information to me about some licensees in Kansas that may have been having some issues with their insurance or reimbursements. Generally when we talk about reimbursements and things like that, it falls outside of our jurisdiction. Also in terms of, advocating for licensees or professionals, that really also kind of falls outside of our jurisdiction, but we do want to make sure we are doing our part to make sure the public is protected. And part of that is to help individuals continue to stay licensed and make sure that things will run smoothly. So within the limitations of our jurisdiction, I did want to make you aware that that news has been brought to our attention. I'm unsure if we have sort of a role in that process, but I did see Josh on the call earlier. I think his video screen is not active right now, but I did want to allow Josh the opportunity to kind of talk on that topic as part of my report. If he's able to do so, if he stepped away, perhaps we can kind of hear from him later. But I did want to give him an opportunity to share that, or maybe some information he knows about that topic with the advisory committee. So.
He may have stepped away just for a minute.
Okay. Well, I wasn't sure this was a real topic for the, committee to take action on, so it's not listed under new business, but as part of my report, I did want to kind of bring it to your attention as a news item and allow him the opportunity to share something on that too. So when he returns, maybe we can have him give an opportunity to kind of talk on that. But with that, we will continue to track the legislative items. I do expect that things will wrap up quickly, probably over the next couple weeks. But we will share information if there are bills that are passed. One small caveat I will give you is that because of the way that those bills work sometimes with conference committees, sometimes parts of bills can be combined and those conference committees, and it's somewhat difficult to track all of the different pieces that get put into bills. So sometimes we have to kind of unpack things after the fact. So if we do find out that there were pieces that were put in that we were unaware of because of how furious those conference committees meet and the legislature passes legislation, I'll make you aware of that later. But as of right now, um, you know, I don't see any other specific items of note for the advisory committee, but if we learn about something later, I'll keep you informed. But with that, I'll end my report and see if there's any questions on the items I talked about or any other topics.
Thank you, Dave. Any questions for Dave on his report?
I was curious if the action that has been taken against the Kansas Nursing Board, like if that would ever impact how they see other boards as well, other disciplinary boards. And to be honest, I don't really understand everything that happened there, but I just had seen that, so I wasn't sure like if that would cause ripples ever to some of the other disciplinary boards.
Yeah, that is something that we're being mindful of. A lot of the attention was focused on the Board of Nursing, some interim committees that met last fall, and some of the action that took place this year. There is a bill that was passed involving the Board of Nursing, and it looked at some of their internal operating processes and also some of their disciplinary actions. That bill did pass both chambers with a few different modifications, and then it has been sent to the governor for review. So we're waiting to see sort of the final outcome of that bill too. Unclear right now if that is something that the governor would veto or if the governor would veto it, would the legislature overturn the veto or attempt to do that. But in terms of, how it may affect the BSRB or other licensing agencies, we are, even though it didn't specifically involve this, we were tracking a lot of that conversation the entire way through. And some of the things that were, pointed out in terms of operational issues, one of the things that they talked about with that is whether individuals knew things like, were their licenses scheduled to expire? And do they have the opportunity to renew their licenses? And one of the things that they talked about was that agency used an opt-in type method of notification. And so if you didn't opt into this method, you would get a postcard about 90 days out, but that would be the only notification you would receive that your license was going to expire. By comparison, what we do is we send a notice 90 days out by email. We send one 60 days out. We send one 30 days out. And then if someone's license does expire, we send them another message and actually a physical letter that informs them your license is now considered expired. That is perfectly fine. It's okay for your license to expire. Just make sure that you don't do things that would require an active license. And it also informs them if they do want to practice again, they can request a reinstatement of their license. And that's a relatively easy process unless there's been some sort of a reason why their license is no longer active, like a disciplinary type purpose. But we really try to do things a different way. So, I don't want to throw any agencies under the bus, but I know they have received a lot of attention based on their processes. So just by comparison and contrast, we really do things a little bit differently or a lot differently in terms of trying to be proactive and notifying people when they have a license that's going to expire, and then if it does expire, what that means. Because I do think some of the other topics that were talked about were, there were some disciplinary actions that the legislature reviewed where someone had a license that expired for one reason or another, and then the individual was viewed as having practiced after their license expired, and then there was a disciplinary action regarding that. And so it is, of course, illegal to practice without a license. But some of the questions regarding some of those orders that were brought forward were, did the person attempt to renew their license and there was a technical issue with their system? And just based on what I observed from some of those meetings, it sounded like the Board of Nursing took a very hardline approach and perhaps was not as reasonable as the legislature would have liked them to be when there were things like attempts to renew that maybe the system didn't recognize, or maybe there were technical issues with their processes. And so I can tell you that we have tried to take a very reasonable approach when it comes to technology and notifications. We've tried to work with people when there were some issues that were involved. So, it's hard to tell if the legislature will, kind of expand the scope of this or if it was limited to that one agency. But even if things don't move forward with any other agencies, we want to kind of learn from this process, examine our policies, and make sure that we are doing things as well as we can. And part of this too is, we have some unique things about the BSRB that a lot of agencies don't have. I'll talk about this a little bit later on the agenda, but we do have a section that talks about our investigative policies and disciplinary policies. And I've put together some slides for the advisory committee. And so I'll kind of share information, I think at that time, about how we do what we do, what we make public, why we make that information public. And so I think that might answer some additional questions as well. But definitely it's an important topic. And like I said, right now that bill, we don't know what the status is going to be. But in terms of our taking note of it, we are definitely taking note of it and trying to do things as best as we can. And if we can improve our processes, we're trying to do that as well.
Thank you, Dave. Any other questions? All right, seeing none, we'll move on. We have no items under old business, so we'll go to new business and advisory committee membership.
Yeah, and I'll frame this topic. So every member of the advisory committee, with the exception of board members, of course, serves a 2-year term. And members of the advisory committee initially submit materials for consideration, and the advisory committee members review those and make recommendations on new members to be added. And when members are added to the advisory committee, they serve a 2-year term. They go by the state fiscal year, so they start July 1st and then run through usually June 30th, 2 years later. And so what we have been trying to do is be diligent about when we have individuals with terms coming up and they have an opportunity to continue to serve on the advisory committee, we ask individuals if they are interested in being reappointed or if they are no longer interested in serving on the advisory committee. And so we had 4 individuals that were coming upon the end of a term. The advisory committee policy says that members can serve no more than 4 terms in a row for a maximum length of time of 8 years. Recently, there's been a change with the advisory committee policy. The board has said if someone is away from the advisory committee for at least 2 years, they would have the opportunity to come back and continue to serve, but there would need to be a gap. And part of that is just to allow for new voices to come on the advisory committee, new ideas. It helps bring new perspectives, and that way the board can continue to receive good recommendations from the advisory committee. But like I said, we had 4 members who were coming upon the end of a term. All 4 of those individuals had eligibility to continue to serve at least one more term. So we asked those 4 individuals if they wanted to be reappointed. 2 said yes, and 2 said no for different reasons. They needed to step away from the advisory committee at this point, or were not seeking to be reappointed. So that means that we will have 2 openings on the advisory committee. And so what I have done in the past in this situation is I've offered to send out a message to all licensees, master's level psychologist and licensed clinical psychotherapist, and basically said, if you are interested in serving on the advisory committee, here's what that responsibility entails. Here's how often the group meets. Here's the expectations. And if you want to serve in this role, submit a letter of interest and also a copy of your resume or CV. And then those will be reviewed by the advisory committee, and they'll make recommendations on new members for the committee. And so if you'd like me to go ahead and do that again, I'd be happy to do that in between now and your June meeting. That way you could review those the information for those applicants in advance of the meeting, have a discussion at that meeting, and then we could forward those recommendations to the chair of the board, who's actually also the chair of your advisory committee. So we could have that process move quickly. But that is an option for you. So if you want me to do that like we've done in the past, I'd be happy to do that for you again.
I think that's kind of the appropriate idea. Everybody agree with that?
Sure.
And Dave, I'd like to take the opportunity to acknowledge and thank Ginger and Josh for their service and participating in these kind of advisory committees takes time and energy, and making sure, as Dave indicated, that we have the kind of right voices here, people from representing different professions in terms of where they work and different regions in terms of where they live and work. And so both of you have brought really great information to us, and we have learned much from you and appreciate your willingness to participate in this process.
Thank you.
Yeah, I completely agree, Dave. I think one of the things that has really been a strength for the board is how active the 7 different advisory committees are. And we really appreciate the individuals being willing to volunteer their time, because we know you have so many other demands on your time, and this is really valuable for the board. And so appreciate it. And if you would like to be reconsidered to come on the advisory committee in the future, of course, that door is open. So.
And for everyone else, as you think about that, if you know of people, we would certainly encourage you to visit with them and let them know that they will be receiving the email Dave was talking about. And if they have interest and time and willingness to participate, that they should apply.
And just to let you know, I have been trying to do a better job at learning how to delegate. It is not one of my natural strengths, but I have been utilizing an assistant for the past 6 months or a year now, and I've been trying to ask Emma to help me with a number of different topics. She's my assistant, and so she will probably be the one to receive a lot of the information from applicants. She may send that message out to individuals as well. So she will probably be the point person on this, but I'll be working closely with her. And then once we have all that information collected, I'll make sure to forward that all to you. But feel free if you know someone who may have a question about that. I'm still a good person to refer those people to for general questions about the position. And so feel free to use me as a point of contact. But when that message goes out, she will likely be listed. So I just kind of wanted to clarify that.
Very good. Thank you, Dave. We'll move on to an overview of the BSRB investigative and disciplinary process and talk about common complaints against LMLPs and LCPs.
Thanks, Dave. I'll go ahead and I'll share my slides here. And these were not in your packet, so we'll probably have these posted after the meeting on the website, but did want to provide some good information for you. And I'll share my screen here now, and we can go through some of this information. And if you do have questions, we can definitely go through any questions you have as well. So, okay, I think you should be able to see my screen here. So I've titled this one basically a presentation on investigations and discipline. First, under the statutes and regulations, the board statutes authorize the regulation of practitioners in 7 different professions. Within the framework of the statutes, the board creates regulations to implement the law. One of the examples of the regulations is the unprofessional conduct regulation. And if you haven't perused all the regulations on our website or the links to those, there is a separate unprofessional conduct regulation for each profession. And a lot of the investigations and discipline really focus on a violation of the law under that section of the law. Under the Kansas Administrative Regulation 102-4-12, which is the unprofessional conduct regulation for master's level psychology, item B says any of the following acts by a licensed master's level psychologist, a licensed clinical psychotherapist, or an applicant for licensure at the master's level of psychology shall constitute unprofessional conduct. And then the regulation goes on to list 58 different things that if those are performed or done by a member that is identified here in this section, those would essentially constitute unprofessional conduct in the eyes of the board. And I didn't put a slide on this, but I feel like it also is important to draw a distinction between the ethics of a profession compared to the unprofessional conduct regulation. Sometimes people say, I want to file a complaint against this person because they violated the ethics of the profession. that's really a little bit outside of our jurisdiction in a sense. While we do try to capture a lot of those concepts within the law, ethics really goes towards what you might see in terms of an ethical code by an association. And ethical violations often are violations of that ethical code for the association, which go more towards membership in that association. The reason why I'm drawing a distinction is because the ethical codes sometimes include things that we would not include, things that may be aspirational, that they would want every practitioner to be the best practitioner that they could be, maybe even encourage publication or different things like that. But we would never, have a regulation that would say it's a violation of unprofessional conduct if you don't publish enough. So really, we're looking for the minimum standards or the duties that you have as a practitioner, that if you don't do these things you're supposed to do, or if you do things that are identified as a violation, that should lead to a disciplinary consequence. So trying to draw in a distinction between ethical codes versus unprofessional conduct. One thing that is unique about our agency compared to a lot of them across the country is that we have a posted investigation policy. If you go on websites for a lot of other associations or agencies, and not just in our professions, but in others, they don't have this listed. They may have an internal document they follow, but our board, posted an investigation policy years ago, and the current version was last updated on September 29th, 2025. Also, I kind of showed where you can access it under the general links on the website. It's listed under resources, policies, investigation policy, and it's just an 8-page document, but it really outlines a lot of, I think, what people would have for common questions in terms of how can people file a complaint, how does this process work, the role of the investigators and agency staff, and then what are the possible outcomes and how things move forward. So all of that is posted on the website. Feel free to take a look at that. It's in PDF form. But as I mentioned, a lot of the work of our investigators is driven by complaints, disciplinary complaints. And all complaints must be submitted to the board in writing. We do require individuals to sign these. Part of that is, often it will involve review of records, and we need a proper release signed by the person who is making the complaint. But also there's a certain level of accountability when you have no anonymous complaints and that the board has these in writing. The form used to file a complaint, it's also called a report of alleged violation, an RAV, can be obtained by contacting our office or downloading the form from our website directly. Once we receive a report of alleged violation, it's reviewed by the investigators for the board. The investigators evaluate whether the BSRB has jurisdiction over the complaint and will assess whether the matter connects to a statute or regulation for the profession. So sometimes if there's just someone who's unhappy, but they're not alleging that there was a violation of a statute or regulation, that really wouldn't rise to someone, violating something under professional conduct. Additionally, another reason we may not have jurisdiction, a lot of people use the term psychologist and psychiatrist interchangeably, but because of the medical degree and other reasons, psychiatry is a different profession and psychiatry is overseen by a different agency. And so the Board of Healing Arts receives complaints against that agency. So if someone were to file a complaint against someone they thought was licensed by us, but they're not, and we know that they are licensed by the Board of Healing Arts, we may inform the person, this is outside of our jurisdiction. They're not licensed by our board, but it appears that they are licensed as a psychiatrist, and you may want to follow up with the Board of Healing Arts. That may be something that, is a logical way that we can direct the person to the appropriate agency. But if we do have a determination that it relates to their practice under their license and we have jurisdiction, the matter moves forward. The licensee is notified of the allegations and is asked for a response. And then additional follow-up information is collected when necessary. The entity that reviews the investigations once they are all ready is the Complaint Review Committee for the board, the CRC. It consists of 6 board members. It meets every other month with legal counsel for the board, the investigators, and the executive director. to review the reports. Now, it's really important to note the only voting members of this body are the members that serve as board members of the CRC. So while the investigators attend, legal counsel is there to advise the board. I am there to ensure it's following the right process. The entity that votes on whether a violation has occurred or what the appropriate remedy should be are the 6 board members. And specifically in that investigative policy, it does note that there has to be at least one public member of the board on the CRC. So it is a blend between professional members and public members of the board, but it does cover a lot of the different professions overseen by the board. The CRC also meets in a closed session under the Kansas Administrative Procedures Act, or the CAPA. And during your board member training or the advisory committee training, we talked about that meetings in general for the board are under the Open Meetings Act, the COMA, except when they are specifically identified as under the CAPA. So when it comes to the review of individual investigations against specific licensees, those discussions happen under the CAPA, and those are not public meetings. For each case, the CRC usually makes one of 3 decisions. Either the facts do not support a violation, the facts do support a violation, or there's insufficient evidence to decide the matter. If the facts do not support a violation, the committee usually dismisses the case without any further action, and we may issue a letter of guidance. If the facts do support a violation, the committee may issue a cautionary letter for a non-disciplinary closure, potentially could propose a consent agreement order, a CAO, that's a type of legal order, or propose a summary proceeding order, an SPO, or propose to move directly to an adjudicative hearing. If the committee lacks evidence to make a decision, the case is returned for the investigation to continue. Some of unfortunately, the common examples of violations that we see, some practitioners make sexual advances towards or engage in physical intimacies with any client, have a dual relationship with a client or exert undue influence over a client, fail to report child or elder abuse in a reasonable length of time, sharing confidential information in an inappropriate manner, failure to report a termination or suspension for malfeasance, misfeasance, or nonfeasance, practicing without a license, falsifying continuing education requirements or renewing license prior to completing all continuing education requirements, or refusing to cooperate with a board investigation. And that is something that the assistant director and I, Leslie Allen, we give presentations to students frequently. And part of our presentations are how to apply for licensure, the role of the BSRB, what resources we can offer. But we also spend part of our time with the students really talking proactively about how to be a good practitioner. And part of that deals with the expectations for professional conduct and how to avoid unprofessional conduct. And sometimes we say, if we have someone come to us that would say, I want to be the best practitioner I can be, how can I guarantee that I will never have a complaint filed against me? Well, the issue with that is you can't. Anybody can file a complaint. So you can't control if you're going to have a complaint filed against you. How you can control things is how you respond to those complaints. So we always tell people, as a professional, just respond to any complaint in a professional manner, because unfortunately what I have seen in a few situations is perhaps someone filed a complaint against someone. It may or may have been without merit, unclear, but the real issue was the person never responded back to the board concerning that complaint, or didn't respond back right away. And it led to a lot of other issues where if they would have just addressed it, sent something back, it would have been fine. Now, that does not mean that individuals are unable to request some additional time, or that they are unable to get assistance from legal services. So we do tell people, we never tell someone they need to contact an attorney or not. A lot of people handle these things themselves, but they may benefit from contacting an attorney and getting some legal guidance. And so if people say, I want to take this very seriously, I'm responding to this, but for me to provide an official response, I would really like to work with an attorney to have them work with me to send something back to the board. Our investigators are great, and they work with people in terms of having that process and taking some additional time to make sure we get the right information from them. So this is more of individuals who just ignore the report of alleged violation, which really compounds the issue, and it can lead to something like a suspension of license, because if we can't verify that things did not happen, the board must make certain assumptions and move forward for the public protection mission of the board. In terms of the disciplinary remedies, we always try to clarify too what lane and jurisdiction the board is operating under. For example, if someone were to file a complaint with the board and say, this person who is providing services to me did so in an inappropriate manner, and now I'm in fear for my life, or I think they're going to physically harm me, we will say we're happy to investigate this under their professional responsibility of their license, but that doesn't mean you can't also take this to law enforcement, because we're a small agency with limited resources, and we really have an administrative jurisdiction over a licensee and their professional responsibility. We lack the financial resources, and honestly, we lack the jurisdiction of what law enforcement may be able to do in terms of offering protection to someone or looking into some of those really criminal matters that may arise. Additionally, some people get the wrong idea about the role of our agency and say, I'm going to file a complaint against this person. I want you to go after them on my behalf. I want you to provide routine updates to me and get damages. Well, that's not what this is either. That's more similar to what you would see in a civil lawsuit. And so if people want to pursue things in a civil way with a lawsuit, that is completely up to them, but that's outside of our role. Our role is really more of an administrative jurisdiction. And under the statutes, we have the ability to revoke, suspend, limit, condition, refuse to issue, or refuse to renew a license. And we can also assess an administrative penalty in an amount not to exceed $1,000 per violation, or we can assess an administrative cost. In addition, we can revoke the license when a license has been voluntarily surrendered, or when an investigation or charges of misconduct are pending or anticipated against a person. In terms of what information goes on our website, we have a board website posting policy. This policy has been in place for several years. It was last updated in 2021. And that policy is posted as well. You can review that website posting and publication policy. It states in part, the purpose of the BSRB, in accordance with the intent of the Kansas legislature, is to protect and serve the consumers of services offered by BSRB licensees. It also states the citizens of the state of Kansas, the consumers served by BSRB licensees, and the individuals that we license have an interest in being informed when disciplinary action, including but not limited to the denial, conditioning, or limiting of a license, the revocation or suspension of a license, or public censure of a license has been taken by the board. The posting policy further goes on to say, therefore, it's the policy of the BSRB that all disciplinary actions will be published except an administrative fine not connected to the delivery of healthcare services when the fine is the only disciplinary action taken, and corrective plans. Corrective plans not connected to the delivery of healthcare services. This specifically includes continuing education violations, but it can include other things too. So if there are corrective plans that are not connected to the delivery of healthcare services, those would not be published either. Additionally, non-disciplinary closure letters will not be published. The message goes on to say that. There are published disciplinary actions on the board's website. We are also required under the law to report certain actions to the National Practitioner Data Bank. That is a federal reporting site. And so we are required as a state agency that oversees health professions that certain things do need to be reported to the NPDB. But in terms of our own disciplinary actions, ones that would involve the practice and the provision of care are published on our website, and they are found there. You can also navigate to that under the complaints section of the website as well. In terms of the history of the disciplinary actions, number of complaints for all practitioners received by the BSRB going from 2020 to 2025. There was about 200 before the pandemic. That first fiscal year involving the pandemic, which was from about July 1st of 2020 through June 30th of 2021, we did see a significant dip that year down to 132, but it did rebound back to the normal numbers in 2022. That's not exclusive to Kansas. I've asked a lot of other states if they saw that. I think there's a few different reasons for that, but that number did dip in 2021. In 2023, it was around 200. 2024, it was around 200. But in 2025, we did see a significant increase in the number of complaints against practitioners. It jumped from about 200 to about 250. And so that has been something challenging for the agency. And so we have done our best to work through those, and we're continuing to work through those. But we did see an increase in complaints against practitioners in 2025. In terms of the complaints or the RAVs for master's level psychology, complaints for all practitioners in master's level psychology profession. So this includes both LMLPs and also LCPs. Going back to 2020, there were 27 combined complaints, 12 in 2021, and then 25, 34, 26, and 34. If you are curious about the proportional ranking of which professions are receiving the highest number of complaints compared to other BSRB license types, when examining the number of RAVs for this profession compared to the total licensees in fiscal year 2025, so looking back at the last full fiscal year, LCPs are actually the profession or the level of license that receives the most complaints. But when I say that, there's 278 licensees, so we're really talking about 12 complaints total. So, keep that in mind, even though, if you were to take the number of complaints divided by the number of, complaints per licensees, it does have the highest frequency of complaints, but we're still just talking about 12 for 278 individuals. And also there is a big difference between a complaint versus a violation. So please keep that in mind as well. The second group that received the most proportional number of complaints was 13, and that was for the licensed addiction counselors. So 13 complaints for 529 individuals. And then for LPs, 26 RAVs, and that is spread out between about 1,078 licensees. And then LMLPs, 8 RAVs, and that is between 356 licensees. So, and also just if you're going to sort of asterisk this in your mind as well, if you recall back to the unprofessional conduct regulation, it did say licensees or applicants are subject to these unprofessional conduct regulations. So there might be a small number of instances where an applicant, while they were pursuing licensure, may have done something, maybe with a temporary license or something like that. But most of these are the complaints against permanent licensees. And then sort of kind of wrapping up this presentation in terms of the common RAVs for master's level psychology in fiscal year 2025, I talked with the investigators for the board, and they said, looking at this profession in 2025, I think there was a combined 20. So, weigh that against the total number of licensees. But the common complaints had to do with dual relationships, not always of a sexual nature, but sometimes of, let's say, a business nature or familiar nature, confidentiality violations. There's also a fair number of complaints regarding foster care or custody or divorce evaluations. And the investigators were basically saying in some of those situations where there's a recommendation, it's not uncommon for the side that did not receive maybe the most favorable recommendation to be unhappy and file a complaint. And as I mentioned, that does not necessarily mean that there was a violation there, but if we're looking at complaints, which are easier for us to track, that's one of the reasons why some of those complaints come in against individuals that do certain jobs in certain environments. And then also another common RAV is performing services inconsistent with one's training, education, experience, or accepted professional standards, which is a relatively broad topic, but it really goes towards individuals that are performing something with substandard care or doing something in a way that is bizarre or potentially harmful, that goes outside of what everyone, or maybe not everyone, but beyond what the accepted professional standards would be, or beyond what that specific individual may have been educated or trained to do. So that is also a common complaint against practitioners in that area. So hopefully that provides some good information to you about some of our investigative processes and how things work their way through the process. and also some more detailed information specifically for your profession. I'm happy to open it up for questions from anyone about these topics, or if you have questions about other topics under this sort of umbrella. But hopefully this improves your understanding. I know we spend a lot of time talking about licensing and other topics, but this is a really important responsibility for the board as well. So I want to make sure you're informed about this part of the process too.
Thank you,
And I'll-
Dave.
I'll stop
Any
sharing my screen.
questions?
Yeah, I'll stop sharing my screen so that way I can kind of see if individuals raise their hand or something too. So
Do you have any insight on why, or what are your thoughts of why it's gone higher in 2025?
yeah, so there are a few instances where we've seen an increase in complaints against people that are not licensed by the board. Some of those, so it's I'm stepping carefully, because basically when there are complaints that do not lead to a public violation, they're usually considered confidential. But I can speak kind of broadly to some of these topics. There are certain individuals that may be in a certain environment to where they're receiving care, maybe residential environments where they are receiving care, and they may be unhappy about some of their living conditions. And so the board has seen some complaints against people that are providing professional services to them, but the board has also seen some complaints against maybe more administrative type individuals that are not licensed by the board. It didn't go towards professional care, but they know that we respond to complaints, and some of those get routed to us, even though it doesn't fall under something that we can necessarily take action on. In terms of other things, I can't really talk specifically about a spike for this year, except to say that, in general, as we've seen more people try to use technology, I have seen sort of a growing number of individuals that get a bit maybe they step a little bit outside of where the boundaries should be in terms of communications with clients. Sometimes text messages kind of follow a slippery slope where they start to seem more like a friend in some of those communications. With social media, we've seen some people post certain things that, they feel like they're just telling stories or sharing about their day, but some of that information, crosses a line in terms of confidentiality. And so some of those things are kind of the things that I have seen with a growing number of frequency. Um, but yeah, I would say probably those would be the types of violations that I've seen kind of increase recently. But some of them are just more people filing complaints against individuals that may or may not be licensed, and then other things may have somewhat of a connection to technology and not necessarily utilization of teleservices, more about the social media confidentiality type things, or maybe the dual relationship boundary crossing type things.
It's important to note as well that there's a growing number of providers licensed by BSRB. So we expect as that number goes up, and it's currently just north of 17,000 licenses. Is that right, Dave?
Yeah, and you're absolutely right. I should have mentioned that early on. 10 years ago, we had about 12,000 licensees, and now we have 17,000. So proportionally, numbers wise, as more people get licensed, we do expect that number to rise somewhat, just as a numbers type thing. So
Josh?
I'm curious about, I'm sure that the investigators or the team works, Dave, with this. And the whole thing was very helpful, by the way. Thank you. That was very interesting. But if you receive a complaint from a client of one of ours, um, it, I mean, I would immediately be consulting my liability insurance and consulting with them, and they provide a great service to do that. But like they're not signing a release for us to talk with you, right? And sharing some details about, helping you understand maybe the nature of that complaint might be a tricky confidentiality slope. What do you guys do with that? Obviously that would delay my response to you all by a few days, probably, in figuring out how to cross that. I'm just curious how if you've run into people reaching out saying, well, I would love to tell you kind of what's going on, but it's, how do I stand here? So,
Sure. Yeah, and that's part of the reason why we don't allow anonymous complaints, because part of the complaint form, there's a section where people can write up the specific details and they sign their name, and then there's another page that really goes towards the release. And when it deals with their own records,
okay. Oh,
we
great.
often need them to complete that release. That way we can share that with the practitioner too and say, we have a signed release from the person. And so
Okay. I'm sorry, I might have missed that. Sorry about that.
that's okay.
Yeah, that's great because I mean, not that I hope or anticipate that would happen to me or anyone I know, but to be able to have that release to share our perception of the issue. So
Yeah, and the board does have a limited ability to subpoena certain records, especially if it could relate to an investigation where those are really necessary. But often, having that signed release really allows us to help the person. And in terms of the different things like insurance type topics or getting legal advice or that kind of thing, I mentioned this towards the beginning. Our investigators are very mindful that we want people to respond, but we want them to do that. We want to be fair to the members of the public that we are trying to protect, but also we want to make sure we're being fair and consistent with the licensees too. So if the licensees say, I really want to talk to an attorney and get assistance and write a response back to the board, we can give people additional time for them to work with their legal counsel and send something back that is either written by the attorney specifically, or they have some assistance in sending that information back to us. And then sometimes they'll send something back and we'll say, okay, this was good. We still have a few specific topics we need some follow-up on, so we can send back more direct questions on those things.
thank you so much.
Sure.
Yeah, so the board as a whole gets to see the kind of data you looked at for each of the professions, kind of an overview of the number of complaints, and the CRC, the Complaint Review Committee, is the group that looks individually at each case. And in terms of your question, Josh, about documentation, sometimes the amount of documentation for a specific case can be dozens and dozens of pages of information that the CRC needs to review to be able to make those kind of decisions. So a lot of time and effort goes into the investigators pulling all that information together and providing summaries to the CRC, and then them reviewing all that information and asking questions and discussing those cases.
I think one of the fortunate things that we have had here with the agency is we have two long-term investigators that assist the board. Cindy is the investigator who's been with the board the longest, and I think she's been probably, I think, assisting the board definitely over 10 years, maybe closer to 15 years. And I think Joan is somewhere close to that, at least in terms of her complete work with the board. She's kind of a split position where she does some investigations and some clinical licensing. But based on the composite nature of the board, even though they're investigating individuals with different licenses and different professions, the common connection is the DSM-5. And so because of the board reviewing those, they don't have to be 100% experts on a lot of the things that you would want someone to be specifically educated or trained, but based on how long they've been working on collecting information and their familiarity with the individual licensees and all these professions, they have a real good grasp of what they're looking for, what the unprofessional conduct regulations kind of point towards. And then the ultimate decision is by the professional members of the board, but also the public member of the board plays a really important role on the CRC as well. I think sometimes people, I've heard people from different groups that would say, "Oh, well, is it just a number of professionals trying to protect professionals?" And it's like, well, there's a public member of the board, so sometimes there are two on that group. So it is not the dynamic that I have seen. Like those discussions are confidential, but no, I think the board does a really good job of looking through everything, making sure they have enough information to make a decision, and then figuring out what the appropriate remedy should be if there was a violation. So I've really I really thought well of this process when I've seen the work of the CRC. Now, in recent times, we have tried to ask more of our board members. We have a very active board. I think I really try to compliment our board members because I think some people get on a board and they think, okay, this will mean that I'll attend a meeting every other month for a couple hours. With our board, we really ask them to do quite a bit in terms of assisting, the licensing staff with review of specific license applicants, with serving on committees like the CRC, which has met for 3 hours every other month. Now it's going to be moving to meeting 4 hours every other month. And so there's a lot of responsibility here, but I really do compliment our board members. I think they have a lot of really good input, and I think they take their time and really make thoughtful and careful decisions, making sure that people that are continuing to practice can do so, in a safe way for the public, but also that individuals that have run afoul of certain things or may not understand a concept that's really fundamental to being a good practitioner, the board has taken steps to make sure they get, disciplinary supervision or additional education or some training in this area to make sure that they are a better practitioner after the process is going forward. So I think that's something we don't talk about a whole lot, but I think that's a really important thing. We talk about trying to keep people in the workforce, but also balancing, making sure the public is protected. And I think that's something the board does a really good job of.
Any additional questions or comments?
I think,
I'm sorry.
sorry, Iris, go ahead.
LCPs were at the top for 2025. I was just curious, was that because the percentage? Did I
Yes.
understand that correctly? Okay. And then do you have a history of that? Is that on like year to year?
I could go back and look a little
I
bit.
was just curious. If you don't, it's not a big deal. I was just
Yeah, I'd be happy to go back and look a little bit more at the previous years. We started tracking that, I want to say about 3 years ago, because we would do a report to the board every full board meeting in terms of the number of complaints for each different license group. But the numbers were always very, very big for social workers. But social workers also make up 55% of our total licensees. And so if you see numbers, but every category of licensees has a different, total number, what do the numbers mean? And so that was upon request of a board member, it was sort of an attempt to kind of quantify it. Okay, we have this many complaints, but how does that compare to the total number of licensees? So can we come up with a number that at least tells us the frequency of complaints if you were to sort of standardize it, given the number of licensees in every profession? So proportionally, they have the highest percentage number of complaints, but in terms of total complaints, it would most likely be master's level social workers or clinical social workers, because those groups make up our highest number of total licensees. So it's a sort of a number thing versus a proportional percentage type thing.
gotcha.
Rebecca?
Well, I was just going to address the fact that I think some of these issues that you're discussing about the complaints, and I I think it made me think about, I don't know how it is across the state, but in Wichita, finding somebody to work with young children is very difficult. And I think that a lot of practitioners or therapists in town have been in a situation where they're kind of pinned on one side and the other parent's angry, and it burns them out and it makes their job really hard to do. So I know that I mean, you didn't specifically address that with your presentation, but it made me think that this is why it's so hard to find a therapist to work with children or children that are going through a divorce or custody issues. I'll get calls for, can you do this? And I do not want to get involved. It sounds like it's going to make one parent very angry and then take way more of my time of fighting and justifying myself and my job and my profession. So, um,
I don't, it's just a general comment. I don't expect anybody to have answers for that, but it's really hard to find people to work, especially with kids, because of the fear of oh my gosh, if the other parent complains to the board, that's going to be taxing for me. So I don't know, just a general comment about trying to find somebody to help work with children based on the fear of a complaint against their license.
Yeah, I think as Dave mentioned, when you're particularly involved in doing evaluations, custody evaluations, those kinds of situations, to your point, the likelihood of somebody being unhappy and then possibly filing a complaint does probably add to the professions who do that
Right.
kind of work.
And yeah, and I think that the numbers that are doing that is just getting smaller and smaller. Um, so I don't know I don't know what the answer is to that, but
Any other comments or questions? Well, I appreciate that presentation, Dave. I think that was really helpful. It's one of the issues that the board deals with every time we meet, and we thought it was important to bring that information to you all to give you just a better understanding of what happens when complaints are filed, how the BSRB handles those, and to give you some specific information about the two groups that this group, has the most familiarity with.
Thank you. Yeah, that was helpful.
Good. If you have the questions, feel free to follow up too. I think one thing I didn't mention is, I mentioned that that number had increased in 2025. I think we're on pace to be a little bit lower in 2026. But still, we want to make sure that we are doing what we can to keep things moving as quickly as we can, knowing that, sometimes we need to gather additional information. Sometimes people request additional time. So we have started to get 2 other staff members involved in the investigation and discipline process to assist our investigators. So we're kind of working with them to get them up to speed and have them learn some new skills too. So we think that'll be helpful. So we're doing a little cross training. We're trying to expand who can do what here in the office. And so that is something we're moving forward on too. Don't know what the trend is going to be, but as Dave mentioned earlier, as we continue to see more and more people get licensed, part of this is a numbers game, and we want to make sure that we're trying to be responsive to that.
All right. That takes us to a discussion on revised EPPP licensing examination timeline update and proposed increase by ASPPB board.
Yes, and so I did want to bring a topic to you that I was made aware of just recently. The Association of State and Provincial Psychology Boards, that is the association at the national level that assist state regulatory boards and Canadian provincial regulatory boards as well that regulate psychology. And while only 17 states regulate master's level psychology, and there's a wide range of ways in which those states do that, and the terminology they use is also very different state to state. The common factor has been the requirement of the passage of a standardized licensing examination, and that has been widely recognized as the EPPP. And so, over the last few years, we've brought a few topics to you concerning that licensing examination. The board of ASPPB had created a second test called the EPPP2, and we had a lot of discussions about that over the last couple of years. Initially, it was introduced as an opt-in test for states, and it was meant to be more of a skills-based test, whereas the EPPP was described as a knowledge-based test. And in some states, they had a separate test that was an oral examination. And the origin for the EPPP2 was the states that had an oral examination to, assess skills was looked at potentially as, subject to bias. And so having a standardized test to look at that was one of the reasons why they created that second test. As I mentioned, the EPPP2 was an opt-in type test, but a few years back, the board of ASPPB decided that they would make that a required test for all states that wish to use the EPPP, and they would relabel them EPPP1 and EPPP2. You may recall, as an advisory committee, there was a lot of opposition to that position by the ASPPB board, and your committee, as well as the Licensed Psychology Advisory Committee, made recommendations to the BSRB board that we should go to the annual meeting and really fight to make sure that was not a second required test. In part because of the cost factor. The EPPP is $600, and the EPPP2 is going to be $400, or maybe $450. And also, just the impact on, limiting the number of people that would be able to join the field. Also, was there really a need for this second type test separate from the first test? And so we worked with a number of different states, including Texas and others, and really made our opposition known. And ultimately, we're able to persuade the ASPPB board to change their mind and not make the EPPP2 a required test. In deciding to do that, what they decided to do was to create a task force that would really look at reevaluating the EPPP test entirely, and looking to see if components from the Part 1 and Part 2 could be combined into a new EPPP moving forward at some point in the future. And so over the last year, that has been one of the groups has been meeting for that association. They are, I think, on pace to maybe have the new version of the EPPP released at some point in the next couple of years, but I don't know that I have a firm date on when they are thinking of putting out the new version of the EPPP. However, one thing that was put out recently was ASPPB had put out a message that said the cost of the EPPP, the board for ASPPB had voted, and they had voted for an increase in the cost of the EPPP. The message said that they would like the cost of the EPPP to increase from $600 to $650, effective April 1st, 2028. With a biannual increase informed by the Consumer Price Index, or the CPI, beginning on April 1st, 2030. So I did a little bit of research to see the last time that the fee for the EPPP was adjusted. And from what I have found is that the EPPP was increased to $600 back on March 1st, 2013. I don't know the history of it before then, but it looks like that was the last increase, which was about 13 years ago. So it would probably be about 15 years between adjustments in the fee. We have a mid-year meeting coming up for that association. The bylaws for the association does say the board of ASPPB has authority to make changes in the cost of that. But of course, as a member jurisdiction in that association, we have a voice in what we say in response to those decisions by the board. And so I wanted to bring this to you to inform you of this increase that they have voted on, and the $50 increase in a couple of years, but also the idea that there would be maybe routine adjustments beginning in 2030. And I just kind of wanted to see what your thoughts were on that. I know nobody wants fees to increase on examinations or other things, but I wanted to kind of allow for some discussion from all of you, what your thoughts were, or if you would want to make a recommendation as an advisory committee concerning those fee items. So I'll turn it over to you. If I didn't frame that or didn't explain that in the perfect way, just let me know, and I'd be happy to kind of clarify that again. But long story short, the group that is in charge of the licensing examination, they have voted their board to increase the fee for that exam from $600 to $650 beginning in 2028. And then also beginning in 2030 to have the fee adjusted based on the consumer price index. So do you have thoughts on that topic?
You know,
I
on
do.
one hand, oh, sorry.
No, it's okay. Go ahead, Ginger.
On one hand, everything is going up. And to be fair, I mean, I'm sure their costs are going up to some degree and they have to cover that. On the other hand, this test is so much more expensive than the social workers, the professional counselors, all of the other areas. It's so much more expensive anyways. We're going to price ourselves out of future licensees because they already look at it and say, well, one, it's super hard, and two, it's super expensive. So I'm just going to be a LPC.
Yeah, I was thinking the same thing, Ginger. I thought to myself, first off, I'd like to know how many people actually take the exam every year and how much this cost is going to increase and what is that cost going to do for them? Where is this going? What does this value do for the test or for the people taking the test?
Mhm.
And what is this going to do for people like, when, like Ginger said, I mean, this test costs more than any other examination. And a lot of people don't just take this test once.
Mhm.
So, I mean, we're looking at multiple times that we're going to have to pay that increase.
Thousands of dollars.
Yep. And so what are we getting for that value? I mean, a license. Yes. Sorry. That's great. Woo. But, like what is that $50 going to get us that's different?
Yeah, I was thinking that. And then also, like, are there scholarships available for people who can't? And then also with all the changes in like loan funding and things available to finish now master's programs versus the doctorate program, like it's already going to be an extreme hardship for new people coming on.
I might be on the outs of I mean, I don't like it. It's expensive, but to me, I remember paying that fee right when I was out of grad school. I had no money, but I remember thinking, this is how serious I need to take this test. Um, I mean, to me, it's an investment in your future, and I want people that take it that are serious about it. I know it's expensive. I'm kind of surprised to hear that it hasn't gone up in that long. Did you say 2013? Okay.
My research says it was last adjusted in 2013.
Okay. So, I mean, I think, like Ginger said, everything's going up. I'm not surprised it's going up, and it could be going up more. I don't know. I don't love the cost, but I also think it shows the people who take it are taking it seriously, and I don't think we can get it to go down. So, I don't know.
Is there like a cost analysis between this test and all the other examinations?
If there is, I have not seen that. I do think it is the most expensive licensing examination, just kind of based on the ones that I recall for the professions under the BSRB. I can't speak to other professions, outside of the BSRB, but at least the ones that I have heard of for our professions, I think it is the most expensive. Well, I appreciate your feedback. If any other individuals have comments or feedback, I'm happy to definitely bring this on behalf of the advisory committee to the mid-year meeting and really push them for information to kind of learn, and I'm sure that there will be others that also asking for the information, but as at a bare minimum, why the increase? Looking for justifications in terms of financial need, or will there be things for individuals that would have a hard time financially, like difficulty, like the scholarship that was mentioned. And then I will also make it known in terms of the general tone of opposition as far as increases as well. So we will bring that to them in the mid-year meeting, but happy to carry that forward. I had thoughts about it myself, but you all are professionals in this area, and we really like to hear from all of you and bring your recommendations. And so I wanted to give you the opportunity to provide feedback so I could carry that forward. So
I had one more comment on that. So obviously I don't like the increase, that thing, but then the next increases that would happen from there are based on what did you say that it was going to be based on?
Yeah, that's the part that I'm kind of curious about as well. The message that I received said that the EPPP fee would increase from 600 to 650 effective April 1st, 2028. And then it said with a biannual increase informed by the Consumer Price Index beginning April 1st, 2030. Now, I think most people interpret biannual as twice a year. I think perhaps it could be meaning to be every 2 years it would be looked at compared to the Consumer Price Index. But
But even if you could have a cap at that, so you raise it from 600 to 650, and then if there's, a 7% jump or a 5% jump, I mean, you're really talking about, you could have some serious increases in price with no ability to have a ceiling on that, if that makes sense. So, I mean, I think even if we can't stop all of it, if you could slow that ball down, that like it's not going to raise by 5% every like twice a year, or it's not. I just think if they could have a max out, like that would be important, because you're already paying so much more than the other professions. And then if you're adding on percentages to that, just because the consumer index is going higher, I mean, your consumer index is already so much higher than all the other professions. So I think they would just need a ceiling on that.
So is it because there are fewer people taking this test than other license tests? And
I was looking the rest
like, is
up.
this like a weird money thing that we just have no idea what's going on behind the scenes? Like, there are more people taking the professional counseling exam. I'm not even sure the acronyms on that one. I can't remember, but
NCE.
yeah,
Yeah,
it's
that
like
one's like 250, I think it said.
but are there like way more people taking that, so it makes enough profit, and there's not enough people taking the EPPP, so the cost has to be higher? Like, I just wonder if this is happening because of budgeting issues that we're not privileged to. I don't know.
they're great questions. The
Depends
message
on
that
the
I
maker of it, I would guess. But marriage and family one is 450. It looks like that's the one that's the next highest.
Yeah, the email that I received, it just says there has been interest in the future cost of the EPPP. The fee structure will remain unchanged, consisting of Pearson's delivery fee and the ASPPB exam fee. Recently, the ASPPB Board of Directors voted to approve a $100 exam fee for beta testing. They're talking about the new version of the exam, scheduled for spring 2027. And then the ASPPB Board also approved an increase in the EPPP fee from the current $600 to $650, effective April 1st, 2028, with the biannual increase informed by the Consumer Price Index beginning April 1st, 2030. But there was no information on here in terms of the specific discussion they had or the reasons in support of the increase. It was more of just communicating this was something that had occurred. So.
Also sounds like, Dave, that by building that second piece in, that means it doesn't necessarily have to go back in front of their board to be voted on for an increase. They're just every 2 years going to look at the consumer price index and then adjust the cost based on that.
Mm-hmm. Which, if you wanted to look at things in an interesting way, which could be fun, they're essentially tying the hands of future boards, because their bylaws say increases in the cost of the exams are up to the board. And by putting this in place, it puts in place an arbitrary increase based on the CPI, which means that their board does not have control unless they vote to not do that, which would be in conflict with this policy that the previous board has put into place. So happy to raise some of those thoughts too. So.
You want to hear my take on why it's so expensive? Um, I don't know the history of the EPPP, but as we know, licensed master level psychology is a small population across the nation. I would guess that a lot more PhD LPs take the EPPP, and the cost of the EPPP is really in line with things like other boards for medical doctors or veterinarians or even even the bar in some states, right? So like I think they looked at the costs of other boards, and I think it's within that market range. Whereas, the NCE and the social work and all that is mainly for master's level people like us, right? And should be in that few $100 range, So um, that's my thought, is that they were going for the market price when it was created. And of course, they're not going to lower it for us.
Well, and Josh, your comment kind of transitions to the next new business item. Dave, do you want me to kind of move to that item?
Absolutely.
Okay. So the last new business item is discussion on a possible licensing examinations for master's level psychology. And ASPPB did put out sort of a note saying that they were exploring the possibility of would there be interest in creating a licensing examination specifically for master's level psychology. I don't know what that would entail exactly. I think part of the reason I have questions concerning what they have in mind is because I think some states that license master's level psychology don't have two levels of practice and maybe have a level of master's level that would always require them to be under some sort of supervision and would not allow independent practice. And so in Kansas, of course, we have our LMLPs and our LCPs, and it talks about two different points on passing the EPPP. But if you take the EPPP the first time and you get above a 500, you don't need to retake it if you later seek the LCP. One concern that I have as far as if they create a master's only, test would be, does it assume that this would not be independent practitioners of master's level psychology? So they would think if you want to be an independent practitioner, you would still need to pass the EPPP. So might there be a scenario where they would develop a new test for master's level psychology, but if you wanted to practice independently, you would still need to practice or pass the EPPP, which means it could potentially involve people passing two different tests and taking two different tests, where right now it's only one test with two different pass points. I don't know. Part of this is that there's such a lack of standardization state by state, but without having a unified scope of practice, or whether it would involve two levels of licensure, those are the big questions that would need to be asked. And so I'm going to explore some of that with some of their staff members as well. But I wanted to bring this to your attention that was something they were looking at. And I think legitimately to be helpful as more states are exploring perhaps opening up licensure for master's level psychology. But because we have a format that's different than some other states, it may create some issues. So I wanted to bring it up to you for education, but also allow some discussion if you have thoughts or questions you'd like me to ask at the mid-year meeting about that topic.
I think the biggest thing is just if there's different tests or whatever, as long as we're not like, bottlenecking towards, well, you guys can't do the same things that we do because you took a different test or whatever it might be, right? So as long as it's not starting to limit the license that we have.
Yeah, when they were originally looking at standardizing master's level psychology, um, they explored the concept of having a limited scope of practice and maybe having two different pathways for master's level practitioners. But a lot of their initial thoughts on that topic, there was a lot of opposition from a number of states. And so they didn't really go forward with that. But yeah, and until there's really a unified consensus of the scope of practice and levels of licensure, this may be a challenging concept. So, um, but I'm happy to, collect more information and see if other states are in favor of it, bring it back to you and get more of an idea of how they would be thinking about approaching this and maybe report back after that meeting.
Yeah, I think that'd be great, Dave. Thank you. Any other additional comments or questions before we move on? All right, seeing none. Any possible additional agenda items for today?
And Dave, just one thing, Josh, when I was going through my report, I think you stepped away for a second. I did let the members of the committee know you had communicated to us about the situation with some individuals losing their, insurance or reimbursement. And I was talking with the advisory committee members and saying, there's certain things that may be outside of our jurisdiction as a licensing board, but we do want to make sure that we're trying to be helpful in terms of protecting the public by making sure individuals are still able to practice and services can still be provided. So I'm unsure if we have a role in this, but I wanted to provide some time for you to maybe share some of what you had shared with us about that news item. And so do you want to talk on that topic for the committee?
Yeah, just briefly. Yeah, thank you. Yeah, some of the others may have seen it too. It wasn't just LMLPs, obviously, but it just seemed like there was a lot of talk on the state forums about sunflower in particular, just seeming to drop people without a lot of or any warning or a lot of warning whatsoever. And first, when I was seeing it on the forums, I was like, well, it's hard to tell what's actually going on there sometimes. But then there was the news article and the reflector about it. That was pretty poignant. And so anyway, um, being a private provider myself, it's concerning for my providers and whatnot. So um, just wanted to bring it to the attention of David Fye because I do think it is a public issue to a degree. I mean, whether you're in urban or rural areas, if you have a therapeutic relationship with a client, then all of a sudden that therapist says, "Hey, I can't see you anymore because I'm not going to get paid." That does put us in a bind, right? Because you want to continue seeing that person as a client, but I mean, you're also not expected to work without being paid. So it is a tough thing. I was educated a little bit by other people about maybe who to advocate about that with or investigate that a bit more. So I was able to kind of pursue that. So David Fye is the only person I knew at the time to maybe send something up the chain. So thank you for responding to me, David. I appreciate it.
Sure. Yeah, and happy to help. I do think this is a good opportunity for us to share information and help people get connected. We were talking about, this is a good opportunity for us to have additional conversations. And so I'm glad you were able to connect with people on that. So,
Thank you.
and Dave, just one other topic before we end. I had meant to mention this during my executive director report, but we do try to work with the state level associations for the different professions. There's an organization, CAMP, that has an upcoming conference, Kansas Association of Master's Level Psychologists. And so that's going to be in Hayes coming up on April 24th. From 9 to 4, and I understand there's a in-person option and also a remote option. So I'll be attending that remotely. I unfortunately have a meeting that I could not avoid. It's part of the Social Work Compact Commission. They have a joint meeting of the Rules Committee and Finance Committee right in the middle of that block of time. So I have scheduled to attend that remotely and attend as much of it as I can. And I've talked to Dave Anderson, and Dave, you said you'd be able to attend that in person. And so, but I wanted to share this information for the rest of the advisory committee members so that you would be aware that that meeting is taking place that day. And I think, Josh, you're one of the speakers.
Yep, that's what I was going to say. I promise I'm a relatively entertaining speaker, and it's a good topic. I think I'm bringing to you all. So check it out.
Great.
Thanks, Dave. And in addition, Josh, you kind of stepped away. We were talking about the makeup of the advisory committee and your stepping away from your role as part of this committee and our appreciation for your time and energy and efforts on behalf of the committee. We appreciate all that you've done and your specific perspective, being a Western Kansas provider and somebody associated with the university training program.
Well, thank you so much. I appreciate it. I've really enjoyed it. And yeah, I assume you'll be hearing from me. I'll probably write some stuff or, I'll still be around, but I appreciate it.
Sounds great.
All right. We are scheduled next to meet on June 3rd. And again, 1 p.m. So put that on your calendar. Unless there's anything else, I'd accept a motion to adjourn.
So moved.
Second.
Okay. Thank you all again for your time and your energy and your expertise. We greatly appreciate that. Have a wonderful rest of your week, and we'll see you in June.
Thanks, everyone.
Good day.